Why is geriatrics important? Geriatrics is important to us personally, since our parents are getting older and we will have to deal with their care. It is also important to us professionally. According to the Administration on Aging, the number of people in the U.S. over the age of 65 is predicted to double from 2010 to 2050. This means that geriatrics will be a leading field in nursing. What do I do once I realize my parents need help? Basically, there are 3 choices to decide what to do with your parents. Number 1, take care of them yourself. This would involve having your parents living in your home with you and being their primary caregiver. Number 2, hiring a home health nurse. This would mean that your parents or parent would live in their home and just have a nurse check in on them or spend nights with them. And finally, number 3, place them in a nursing facility. Nursing homes take on primary care of your parent and make sure they get fed, bathed, and administer their medicine. Why do it at home? According to an AARP survey, 90% of people over the age of 65 surveyed said that they want to live at home as long as possible. Staying at home is a great option for elderly people, especially if they have family members willing to help them. First of all, it's home. It's a safe, well-known place where they can live comfortably and enjoyably. Secondly, it can save money. According to CNN Money, assisted living can cost upwards of $40,000 a year, while the cost of staying home averages about $21,000 a year for a typical part-time scheduled nurse. What does a home health nurse do? According to interim health care, the nurse would dispense your parents' medications, educate them about their illnesses, and follow up with them on treatments and surgeries. They would be the ones to call for more assistance if your parent got a bed sore or a wound from falling or bumping an object. They would also adjust medications to match the doses your parent would need to be taking. We spoke with Victoria Landis, a PUC School of Nursing graduate who was a home health nurse for approximately 4 years. Victoria stated that being a home health nurse is a great branch of nursing for people who do not like hospital floor nursing. She said home health nurses create a more long-term relationship with their patients, and she loved that she had a more direct responsibility over her patients than she did as a hospital nurse. About 40% of elderly patients in a convalescent home are there after a surgery or being in ICU. 23% are end-of-life care. Sanitary conditions should always be kept at its best, as the elderly often have wounds to heal after surgery. The nurse must coordinate between the doctor, hospital, family, pharmacy, hospice, social worker, and facility where they work, all on the behalf of the patient. Respect and meeting their needs should be the focus of any quality facility or nurse. Life is hard for the elderly in this phase of care. Family members are not always nearby to give emotional support or attend to their special needs. Their spirits are often lowered, and many times this leads to their quick demise. Workers are often overloaded and have little time for the individual. The role of the nurse is to admit patients, provide ongoing assessments, and chart findings every shift, and when transferring to another area. The nurse must be very sure of which medications are to be given, when, and the possible side effects. Awareness must be maintained that many of these people are dying and or at the end of their lives, and they need to be given the personal care they truly deserve, and should also be a part of the nurse's role, and to keep it in the minds of the other workers as well. The nurse should educate the patient and any family on what goals there are and what to either expect or hope for. The nurse is to be an advocate in all areas that concern the patient. There should be diets to fit their needs and some level of social interactions, such as music or activities. Much personal interaction is required with the elderly in convalescent homes to keep healthy hearts, minds, and bodies. What is hospice? Hospice compassionately cares for people who are near the close of life. Hospice and palliative care focus on how terminally ill persons and their loved ones live each day, providing comfort and guidance along the way. When do you need hospice? When a cure is no longer possible, hospice provides the type of care most people say they want at the end of life: comfort and quality of life. The most common statement made by families who chose hospice for their loved one is, "We wish we had known about hospice sooner." So who provides care for the patient in hospice? Hospice care is delivered by a team of caregivers, which includes physicians, nurses, certified nurses assistants, social workers, spiritual and bereavement counselors, and volunteers, all fully trained and experienced in end-of-life care. Complementary therapists and other specialists may complete the team. As a hospice nurse, you may act as an intake nurse, visiting the family who has contacted hospice to see how hospice can assist them with their loved one. You might be the nurse practitioner who assesses where the patient is at in the end-of-life process and act as a liaison between the patient, family, hospice administration, and other staff. You could also be the triage nurse, called in at any given time. One major role in hospice is the bedside nurse, for care that will start out as visits and can turn into full-time depending on the patient's needs. You can also work as the case-working nurse, who is called when the patient passes and coordinates with the funeral home. Nurses in hospice programs may perform daily checkups on patients, create treatment plans for their conditions, and assist in end-of-life care and decisions. Where and how is your patient taken care of? Hospice care is provided in freestanding hospice care centers, hospitals, nursing homes, and assisted living facilities. In most cases, though, care is provided in the person's home. Hospice organizations practice fully informed decision-making by the patient and family. This ensures that their care truly reflects their needs, wants, values, and traditions. As a hospice nurse, you are likely to be the one hospice staff member who spends the most time with the patient. Having compassion and a good listening ear is vital. Being able to understand death and its processes, but not internalizing it, is crucial to long-term hospice nursing. You can work as an ASN or a BSN and up. The income is slightly less than in a hospital setting, but you have more flexibility, and job opportunities in all three of these areas are continuing to increase, as is the need for skilled geriatric nurses.